Hi, everybody. This is Alan Fine. I'm here with Eric Odin, who's the Senior Vice President Americas for Qatar Airways. You know, they never stopped flying through this whole pandemic. We've been learning about them all the time. We're going to learn about their cleaning protocols, which have been really incredible, and their unbelievably lenient change policies. All this on Insider Travel Report. Eric, thank you for being with us.
Thank you for having me.
Thank you. How's Qatar Airways handled the coronavirus over the past few months?
Well, when all the various skies around the world started, closing down in view of the pandemics, there was obviously the big decision of whether we would continue flying or we would stop flying. And we decided that we would continue flying, which was a great decision in hindsight. At first, it was important to identify the priorities of passengers. And basically, the first priority for them was to know more about the hygiene protocol. So within a week of the pandemic being announced, we had a film showcasing basically all the things we were doing.
You were very transparent, and we ran that film.
Okay, very good. So that was point number one. I think people wanted that transparency, the behind-the-scene view. The second thing they wanted was obviously they were worried about their money in case they had a ticket already or in case they wanted to buy a ticket. So we introduced this policy called Travel with Confidence, whereas people, obviously, they could get a refund if their flight was cancelled. But if they were buying a ticket, basically, they could change it as many times as they wanted. They could even change the routing if they wanted to within an allowance. Or if they did not want to travel, they could get the value of that ticket onto a travel voucher for a duration of 2 years, validity of 2 years. If they were frequent flyer, they could get miles, obviously. So that was important for people to have that.
But there was that 5,000 mile.
Correct.
Talk about that, because I found that quite impressive.
Well, it's building up confidence is about trying to give people the flexibility that they need. At that stage, let's be honest, there's very little control, even at the moment, as to where people can go or can't go. So I think the flexibility was essential to the proposal.
But what was that clause in the change policy about 5,000 miles?
So basically, people could change their destination to another destination if it was within a 5,000 miles trip.
It's amazing. Because you don't see that happening just every day and with every airline.
Well, these are quite exceptional circumstances.
Right. Eric, tell us about what's the situation in Qatar and the rest of the Middle East. How hard have they been hit with COVID?
Well, Qatar was actually one of the countries in the Middle East that reacting one of the fastest in closing down its borders, just to make sure that they could actually contain the infection, the rate of infection. So basically, at the moment, people can only transit through Qatar. The hygiene protocol at the airport is extremely stringent. Everybody entering the airport has to be temperatures checked. There's actually very cool robot that look like Robocop that people wear to check temperature. And a lot of they've got some robots that actually with ultraviolet lights that kill sort of all the microbe and disinfect the air in the airport. So all that was done great. Qatar has had a lot of testing, which is great. So 400,000 people were tested, and actually very, very little ratio of deaths, only 138, I think. So in that respect, it's been great.
So, Eric, in all this flying and you never stopped, I assume it wasn't just cargo and it wasn't just a few early adopters of flying, but you also participated in helping medically internationally. Can you tell us a little more about that?
Yes, we had this scheme whereas we gave away 100,000 tickets to medical professionals.
100,000?
100,000, yes. And all over the world. So every country in the world was eligible. It was the biggest offer we've ever done of that kind. And we had, I think, over 7 million people applied for it. So it was massive, but it was just a great opportunity to give back to all the medical professionals who've been doing such a fantastic job.
Let's go back to the airline. How many routes roughly has Qatar had to cancel over the period? And then did the airline keep certain routes? I know that cargo kept going and certain routes kept going. Can you give us an overview of that, please?
So originally we were flying 100 and over 160 destinations. So if I'm not mistaken, I think it went down to 25 at one stage, and it's now going back to 80 destinations by the end of the month. We never stopped flying to the US, actually. We always flew from Chicago and Dallas throughout the entire pandemic. And the reason we flew from Chicago and Dallas, it's because these are two huge American Allied hubs, our partner, and therefore it was an opportunity for people to fly from anywhere in the US to the gateways and then onto the Qatar Airways network.
And so as this is starting to open up, you're opening up more cities and you're able to work with American Airlines and JetBlue. Let's talk about that a little bit.
Yes, so we've reopened JFK, Delhi, Los Angeles 5 times a week, Washington 5 times a week, and Boston 5 times a week as well. So we now got 6 departure airports from the US. We also fly from Montreal, Toronto, and in Sao Paulo. And basically, Los Angeles, Chicago, Dallas, and JFK are strong American airline hubs, so easy to connect. And both Boston and JFK are strong JetBlue hubs as well. So a great opportunity to consolidate our traffic. And I don't know if I can't remember if I mentioned Washington as well. We fly from Washington too.
So we ran that video really early where we showed the cleaning and it made me feel good. And recently I saw a picture where are your stewards dressed in white? I mean,
yes.
I feel like we've got doctors taking care of us. That's how. So what I want to ask you is, let's talk about the cleaning on board, the protocols being used, and how are you're doing all this to reassure passengers. Let's discuss that.
So originally, when we did the first film, we were basically dealing with the cleaning protocol at the time. So it was actually very, very stringent already. Gradually, we adapted it to include all the elements that were important to the client. What's important to remember is that we probably are the airline with the most experience in biosafety by flying through the crisis.
Because you flew for the longest time, never stopping.
So we obviously reviewed all our processes and enhanced them. We added hand sanitizing gel on board so that people have wide access to it. The crew at one stage were wearing masks, then they started wearing goggles, then they wore the full PPE, which have now changed to still a PPE, but looking a lot more, it's branded, it's a lot more stylish, but the level of protection is the same. But I think it's also a bit less frightening for people, which is good. So masks are mandatory on board, and recently we introduced face shields that we provide ourselves to the passengers.
I think it's important to point out, though, you've been traveling all that time, you have all this experience, and what kind of repercussions? I mean, if you were doing it inappropriately, you would have found out by now.
Absolutely. And also we have a feedback process with our passengers on board. Therefore, they tell us what they like, what they don't like. We were able to tweak the product just because they said, we want, for example, in business class, we have a stunning product which is perfect for social distancing because it's a proper suite with a door and so on. However, people wanted less interaction with the crew. So we had to tweak the product a little bit. We didn't change the offer. We still get 4 hot entrees. But instead of being brought in gradually with the table being laid out and all that stuff, now it's actually brought on a tray. So all that feedback was interesting. It's just making sure that we could tweak the product the best way possible.
Wow. Yeah, I've heard about that. I'd like to sample that product. But let's talk about a big issue in the United States is the masks. Are they mandatory, and do you enforce it for the guests?
They're mandatory, yes, absolutely. It's an important product. It's an important part of the travel protocol at the moment. Actually, at the beginning, we were not providing them ourselves. We made them. We recommended people to bring them, and actually realized that most people had them anyway, and most people prefer wearing them. We haven't had any of the incidents that I've read in the press.
So nobody has objected, and there's been no confrontations. That's great. But now, as far as booking and filling a plane, there's some controversy in our country about the middle seats. And what's your position?
Well, I mean, obviously, at the moment, the flights are not very full, so we welcome that social distancing. We have a very strict protocol on the ground of making sure that all the, the distancing is indicated on the floor at boarding, particularly at the hub. So we're big on that. On board the plane, within the possibility, we encourage it. If the flight is full, we don't. Somehow, between, we have one of the youngest fleet in the world, less than 5 years, with very, very modern air filtering. We provide hand sanitizer, we provide the face shields, we recommend the masks, the crew wear the full PPE, the meals are entirely secure and contained, sealed actually. So we're very confident that travel will be without any consequences.
Part of what we're trying to do is we're trying to get travel advisors to get the clients to understand the situation in the air. Certainly, we're learning about the HEPA filters and the way the air flows. I think I learned that first from you, and I've heard other airlines talk about it. And we've also heard that no airline can really survive with the middle seats empty for too long. And so we need to be able to believe that the HEPA filters and all the other things that are being utilized are sufficient. And and obviously, as you've been operating all this time, it's not been a problem for you yet, but you haven't been full to capacity yet.
No, we have. We've done we've done 300 charters flights. We had a bring you home policy after the crisis peaked, and basically on those flights, the flights were actually very, very full.
That's great. That's what I wanted to hear, because obviously whatever you're doing on a full flight worked.
Absolutely.
Now, in dealing with travel advisors here in the U.S., are you finding that U.S. travel advisors are starting to book?
Oh, yes. That actually been quite spectacular, because as much as there was definitely a lull around May. May was particularly low, but as some countries starting to reopen, or we started having special permission for extra flight to some places like in the Middle East, like Kuwait, or we saw immediately a spike in booking. So as soon as we have a new country reopening, we see a really, really big spike in booking. So, which shows that there is actually demand. It was amazing. We sold a lot of Australia, for example. I mean, you can imagine going from the US to Australia via the Middle East. It can sound a bit long, but it was certainly a way to get there, and people were able to do that.
Wow. All right. Well, let's wrap up. What should travel advisors be doing right now? What message do you have for them as we come out of this? What should they be thinking and doing?
Well, my message would be quite selfish. Is I think really they should push and book the airlines that actually have kept them informed, that have kept flying, that have been very transparent about their hygiene policy. I mean, if there's one thing that should come out from that crisis, ideally, is that there are big differences, and I would hope that people will be interested in our offering even more now, knowing all the stuff we've done over the last few months at a time where it was particularly difficult for airlines.
See, that's the problem. There are routes I want to fly that you don't fly. So, and I do think that clients are going to be choosing their airlines based on these little tiny perceptions on health and safety.
I hope so. I certainly will look forward to welcoming them on board.
Thank you for talking to us.
Thank you.
This is Alan Fine for Insider Travel Report.